Hello, darling.
Oh, Mum, are you in pain?
I'm sore and achy all over. I just didn't want to worry you again.
Oh, Mum, you got to tell me. Like, it's so much better when you do, because we work at it together, and it makes us both feel better. Is it the usual pain?
It is in my back. It's the usual pain, but it's going down to my hip. And I took some paracetamol with my lunch, so I'm sure I did. It seems a while ago now.
Maybe we should try some of the liquid morphine that the doctor prescribed. I believe that it works really well in conjunction with the paracetamol. They complement each other.
Oh, it's very strong.
Yeah.
I try not to have it too often.
Yeah, I read something about it, that it's better to take pain medication early on, as it becomes more effective than when the pain's really bad. You want to give it a go?
Yes, of course.
Okay, I'll just check on the chart and see how much you need. I got a syringe from the chemist to draw it up with. Usually draw it out of the bottle, but we might use the cup today. It might be easier to get it. Can you manage that, Mum, or do you need a hand?
No, thank you, darling. I think it's better if I'm in control of it. Thank you.
Awesome.
And it doesn't taste very nice.
Oh no. Here, look, have a sip. That'll wash it down with that, love.
Thank you, darling. Thank you, darling. Thank you. Thank you, darling. I'll be right now.
Okay, I'll just pop it onto the chart so that we keep up to date with everything we need to do. Yeah, I don't like seeing you in pain, Mum. It's much better that we have a plan together.
So let me show you how I manage Mama's medications, and it might help you with your sister. So I've just got the chemist to put everything in a blister pack, and it really helps to, now that Mum's on lots of different medications, to work out which medications to have at what time. And now that she's having trouble swallowing, I've asked the doctor to put a lot of her medications in liquid form. So things like this with the coating, that would need to be in liquid form because we can't crush that one. Things like this one can be just poured in like that. There's also a cutter that you can get from the chemist, and that helps to, if you cut it first when you need to crush them up. And if you're just doing one at a time, some spoons can be really, really good. But if you need to do quite a few together, then the mortar and pestle can be really handy. There's also this one, which is really good if you need to, if you're out and about, you need to crush some medications. You can just do it like this, and that can be really good as well. And then I just always mix it with something sweet, so some yogurt or ice cream or custard or jam, just to take the bitter taste away. Okay, so I'll just go and give these to Mum. Mum, it's time for your medication.
Darling.
Hello.
Oh, thank you.
Sit you up nice and straight.
Just a minute, darling. There we are.
Okay, there we go.
That's better.
Okay. Just give you a sip of water just to make your mouth nice and moist.
Yes, my mouth is dry.
chin forward. That's right.
That's lovely.
Okay, no bitter taste that time?
No, you've done very well.
Oh, thanks,
No
Mum.
bitter taste this time at all.
Anytime you're using one of these bungs, you need to wipe it. If you're using the blue bung, push the syringe onto it and turn it, and it will lock it in place. When you push the plunger of the syringe, you're doing it really slowly. Sometimes you'll see a butterfly that's connected to a syringe driver, and whatever bung that you're presented with, there's always a way of introducing medication. So if you're using one of the rubber bungs, which you can see here, then you're using a sharp needle to put in the rubber. The way the needles are packaged is they're packaged in a way you can open the packet like you're peeling a banana. And in that way, you're not actually touching the end of the syringe or the end of the needle. And so then you can connect them together and it keeps it all nice and clean. It's a really good idea to dispose of it in a sharps bin.